So this is the manual muscle test for shoulder flexion. This should be done in a seated position with the forearm pronated. So Maddie, if you don't mind, what I'm gonna have you do is lift your arm up to 90 degrees. Perfect, come down once. I'm gonna do it for you then. And those are both the same. So now we're gonna test our strength. So I'm gonna have you hold this position right here. I'm gonna apply pressure downward, don't let me move you, and we're gonna do it for 5 seconds. So we'll stabilize at the shoulder, and then just proximal to the elbow, I'm gonna push down, 5, 4, 3, 2, and 1. Perfect, you can relax. That would be a 5 out of 5. The gravity lessened position for this would be in side lying with me supporting her arm, and you can also palpate the deltoid or bicep for trace activation. So this is going to be the manual muscle test for pec major, the sternal portion. This is going to be done in the supine position. So let me demonstrate. What I'm going to have you do, Maddie, is can you start at about 120 degrees abduction. I'm going to pull your arm down and in towards your opposite pocket. Perfect. Now I'm going to do that for you. Keep your elbow bent at 90 degrees, please. Perfect. Good. They are the same, so we're going to test your strength. I'm going to lift you up here. What I'm going to have you do is hold this position while I'm trying to pull you outward, okay? So 5, 4, 3, 2, 1. Perfect. Her manual muscle test score would be 5 out of 5. The gravity lessened position for this would be, you could do seated and then moving your arm across a mat table or a tray. This is the manual muscle test for shoulder adduction and downward rotation via Kendall's method, pretty much testing mainly the rhomboids. This test should be done in prone. We're going to be testing the left side, so her right side or alternating side should be, shoulder should be abducted and flexed, kind of whatever's comfortable for the patient. We're going to be testing her left, so what I'm going to have her do is adduct her arm, bring it close to her body with a little bit of external rotation and extension, and then the elbow fully flex is going to be the position we're going to be testing in. So Maddie, can you bring your arm up, back, and in? Awesome, awesome. Do it by yourself without any help from me. Awesome. I'm going to take you through that motion as well. Perfect. Active and passive are the same. Okay, so what I'm going to have you do, Maddie, is hold your arm here. I'm going to push up and out. Don't let me move you. You also want to kind of stabilize at the shoulder, push at the elbow. 5, 4, 3, 2, 1. Come down. I'd give that manual muscle test a 4+. The gravity lessened position for this would be seated, and you can bring the arm behind their back. This is the manual muscle test for wrist flexion, in particular the flexi carpi radialis. This test should be done in the seated position. As the therapist, you're going to support the forearm, put the forearm in supination, wrist in slight extension, and then to address the flexi carpi radialis, you're going to go into a little bit of radial deviation. So what I'm going to have you do, Maddie, is I'm going to have you move through the motion of pulling your wrist towards your thumb and in, and then back and out. Perfect. I'm going to take her through that motion. Awesome, awesome. So to do this test, like I said, we're going to go into a little bit of wrist extension, radial deviation, with resistance applied with the index and long fingers over the first and second metacarpal. And then we're going to be pulling into extension and ulnar deviations. So can I have you hold this position right here? Don't let me pull you backwards. Keep it. 5, 4, 3, 2, 1. Awesome. That manual muscle test score would be 5 out of 5. A gravity lessened position would be having the arm in neutral on the table and going through the motion that way. And then to assess for trace, you can go into full supination and palpate for any trace. So this is going to be the manual muscle test for finger abduction. Primarily assessing the dorsal interossei and the abductor digiti minimi. This test should be done in the seated position, but what you're going to do is you're going to have the forearm pronated, wrist in neutral, and then the fingers are going to start in adduction and a little bit of extension. So Maddie, what I'm going to have you do is, can you just open up your fingers as wide as possible? Awesome, and bring them back together. And then I'm going to go through and actively do it to make sure the active and passive range of motion is the same. It is. These ones you're gonna assess all of them a little different individually. We're just gonna do one for the sake of the video. So what I'm gonna have you do is, can you hold these two fingers apart from each other? Don't let me push you together. And as a therapist, you're gonna be stabilizing at the wrist. Hold it, 5, 4, 3, 2, and 1. Awesome. Her manual muscle test score would be 5 out of 5. A gravity lesson position for this would actually be the same, and you'd just be palpating over the dorsal interossei or the abductor digiti minimi. This is going to be the range of motion test for shoulder flexion. This test should be done in supine with the arm by the body, elbow extended, forearm in neutral, and palm facing the body. So Maddie, what I'm going to have you do is I'm going to have you go through this motion right here, come back. So can you go ahead and do that for me? Awesome. Any pain with that?
No.
So I'm going to run you through that motion. You just relax the best you can. Some seems to be a firm end feel. So the landmarks for the goniometer on this one are going to be the stationary arm is going to be the lateral midline of the thorax. The axis is going to be the lateral aspect of the acromion process right here. And then the moving arm is going to be the lateral midline of the humerus pointing towards the lateral epicondyle. So, do you remember the motion we went through?
Mm-hmm.
Okay. What I'm going to have you do is I'm going to have you go, once I get this in position, I'm going to have you go through that movement. Go for it. Nice and slow. Awesome. Any pain with that?
Mm-hmm.
Okay. Is that about as far as you feel like you're going to go? Okay, and that's good because you're starting to lift your scapula. Range of motion here would be 174. The anatomical norms are 160 to 190, so she was good. So this is going to be the range of motion test for forearm pronation on Maddie's left side here. This position should be done in the seated position or standing. Seated just seems to be easier, with the elbow flex at 90 and the forearm in neutral, and wrist in neutral as well. So what I'm going to have you do, Maddie, is pronate your hand, which is pointing the palm towards the ground. Perfect. Come back. Any pain with that? Awesome. Then I'm going to take her through that. Here, I would note that is a firm end feel. Come back. Perfect. So this goniometer tends to work the best for this. The stationary arm is going to be through the parallel with the anterior midline of the humerus. The axis is going to be in line with just proximal to the styloid process of the ulna, so right here. And then the moving arm goes on the dorsum of the forearm, right here. Again, just proximal to the ulnar styloid process. So what I'm going to have you do once I get this positioned here, I'm going to have you again point your hands towards the ground. No pain with that movement, right?
No.
Come back. Awesome. She got a 79 degrees. The anatomical norm would be 70 to 80, so she is good. So we're gonna do the range of motion measurement for MCP flexion and then follow it with the extension. This test should be done in the seated position with the forearm supported and then the wrist and hand in a neutral position. So what I'm gonna have you do, Maddie, is at your knuckle joint, I'm gonna have you bend your finger up underneath you as far as you can. Any pain with that? Awesome. Straighten it back out, and then I'm gonna go through that same movement as far as I can. I would say that is a firm end feel. And then we're gonna go ahead and take a measurement. This goniometer tends to work best. The stationary arm is going to be proximal to the MCP joint. The moving arm is going to be distal, with the axis being on the dorsum of the joint, which in this case is the MCP joint. So what I'm going to have you do, Maddie, is I'm going to have you bend your knuckle underneath you. Perfect, perfect. And then you can relax. In terms of flexion, I got 87 degrees. The normal being 85 to 100. Extension is very similar, except we're just going the opposite direction. So what I'm going to have you do is you can let your fingers bend, but I'm going to have you come as far up with the knuckle as possible and then come down. Any pain with that?
No.
Awesome, awesome. I'm going to run you through that movement as well. Perfect. Let me pause the video. So this goniometer tends to work better than the last one I had. So if you remember correctly, we're doing MCP extension. So if you don't mind, let me get this straight. What I'm gonna have you do, Maddie, is lift up your finger. Good job. And I'm getting roughly 22 degrees of extension, which would be the anatomical norm, because the anatomical norms would be 20 to 25. So this is going to be the muscle length assessment for pectoralis major. This is the general, so we're not going to differentiate between the clavicular and sternal portion. To do this test, you're going to have your patient lay supine, and then Maddie, if you don't mind, I'm going to have you collapse your fingers behind your head. Awesome, awesome. You want to try to make sure the cervical spine is not too flexed, so as close to neutral as possible with the hands behind it. And then what I'm going to have you do, Maddie, is just relax the shoulders and arms. So push a little bit. I'd say there's probably a firm end feeler there, although my patient is pretty hypermobile. And then to measure this test, what you're going to do is you're going to get yourself a tape measure. You're going to measure from the olecranon process of the elbow to the table or whatever surface you're using. So my patient here has about 3 inches on her right, and her left is very symmetrical at about 3 inches as well. So she is good.